This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.
And welcome back, everybody. Here we are heading into the summer. Many of us thinking, I want to look a little less heavy, if you will. Going to be shedding the hoodie. I'm in the New York area. I'm still wearing my hoodie. I had it on this morning. But we want to lose some weight. On the radar of many are medications that take care of that. And we're going to talk with somebody who supports those medications for patients and clients in Colorado. And we're going to reconvene with her. We talked with her in the past about this and get an education on what this is all about. Misti Janikowski is back with us. She's the woman at Go Figure Health. How are you doing today?
I'm doing very well. I'm very well. How are you?
Very well. Good to have you back here.
Thank you.
It's still popular. I don't want to mention the names that most people go by the brand name. But semaglutide is that the pharmaceutical name?
That is the pharmaceutical name. Yeah.
Okay. For anybody that doesn't know, let's kind of reset for just a moment here and how the med works and different ways to administer it as well.
Okay. So with semaglutide, you can administer it multiple ways. The most popular is through an injection. It's a very teeny needle that you put into your abdomen. I can never say abdomen. And it's once a week. But they also offer pills that you could take every day if you're needle adverse. Or with the tirzepatide, which is the stronger dosage, they actually have lozenges as well. So you can take those and suck on them every day as well. The third or the final option is a sublingual. And that means that there are drops that go under your tongue that you just kind of let absorb into your body. That's another one that you have to do every day. So aside from the injection, everything else is a daily. I've got to remember to do that. I've got to remember to do that.
And with the sublingual, I want to make sure I heard that clear. Is that every day?
That is every day. Yeah.
Interesting. I'm kind of intrigued about that because it's my understanding that goes right into your system. There's no waste, if you will, because when you consume something, I hear only 60% of that actually makes it into your body. Everything else, the rest gets filtered out. So I would think the sublingual would be, equivalent to the injection. What's the difference?
Yeah, the difference is that the sublingual goes straight into your bloodstream through the mouth. The injection goes into your body through the abdomen, and the studies that I've read is they're equal as far as effectiveness, and whereas the pill is probably less, and then the lozenges, I have not seen any studies on the lozenges, but the sublingual daily and the shot weekly are pretty much neck and neck as far as the efficacy or the effectiveness.
Okay. What's going on when you take this medication? What's it doing? Is it curbing your appetite?
Yeah, it's an amazing find that they had, and it's been 20 years in the making. They've used this medication for our diabetes colleagues and friends. They've been on this medication long-term. There's no long-term issues with it. But essentially what they found is that the peptides that are in the stomach, the lining of the stomach, for heavier people, they don't have as many. So this medication goes into these peptides that then slows down your digestion, that makes you feel fuller longer, so you don't eat as much, you don't have the urge to eat as much. But for me, the first thing that it did for me is it quieted the noise down. And I don't understand why this is all, I don't get it. My brain would function looking for food, thinking about what I needed to have for breakfast, what I needed to have for dinner. And it wasn't even dinner time yet. It's able to quiet those noises that will help you in your journey to lose weight. If you want it to be faster, watch what you eat, exercise. I didn't do that, and I still lost 50 pounds. So just the medication slowing down your appetite, or slowing down your digestion, knowing that you're full, not having the constant barrage of gotta eat that, thoughts, they are what really help you lose your weight because you're not focused on the food anymore and you're full.
I totally get what you're saying because I have those the chatter, and
Yeah,
yeah, I might be like a little hungry, but I'm not really
yeah,
famished. And then like I'll grab something to eat, even if it's a salad. I'm looking
mm,
at one right here, and then you take one bite, and it's like I
right.
wasn't even feeling that way 5 minutes before. It's almost like the floodgate opens, and that
Yeah,
then you.
yeah.
Fortunately, today it's a salad. Other days it could be something else that's really shouldn't be eating a lot of.
Yeah.
And then with that chatter, you just gavoom it and it's gone.
Hmm.
And as opposed to taking time, feeling full, not
Yeah.
eating more than you should. Is it with semaglutide, is it only curbing your appetite or are there other chemical reactions that are going on in your body?
Well, the other reaction is it's slowing down the metabolism.
Okay.
So your stomach will stay fuller longer because it's taking its time and it's processing that food slower. So you feel full longer. So there's that sense of fullness even beyond taking the shot. So the day or 2 or 3 days later, when you're eating, you still have that sense of fullness. So the food's different, all of that's different, but that sense of fullness is still there. And so that's I think that's the biggest part of the semaglutide for me anyway. I just feel full. I don't feel hungry nearly as much as I used to, nearly as much.
How about side effects? Any?
So there are some side effects. They have some people experience. Let me take a step back. Because you're introducing something to the stomach, there isn't a possibility of having higher acidity in your stomach. So people experience having to have Tums or having to have an over-the-counter nausea type of medication, omeprazole, something like that. So that's the main one that people experience. But with the FDA changes, I understand that they have to include the B12 or something like it in the shot. And what that means is you're getting the nausea medication the same time you're getting the semaglutide, which helps stave off those bouts of nausea. I've been on that version for about 2 weeks and I've had no nausea whatsoever. I haven't had to have a Tums or anything. So that's one of the side effects. There are two things that we will not treat at Go Figure Health is if you have diabetes, we recommend that you go to your primary care physician. And then there's a specific type of thyroid cancer that is like 1 in 100. It's very, very rare. But if you've ever tested for it, our provider, our clinician will ask you to see your doctor as well.
Hmm.
There's no studies or I haven't seen any studies that say it creates any issues with the thyroid, but it's just something that they watch out for.
Wow. Okay. So when it comes to the nausea, are you just referring to the excess acid in your stomach could make
Yeah.
you feel a little queasy? That's yeah.
Yeah.
Not like
Yeah.
not like the nausea, motion sickness kind of feeling. Just
Right.
talking.
Yeah. Thank
Okay.
you for that. No, it's you just have that sense of, I have that little acid in my stomach and it's not pleasant. It can be handled with Tums. So some of the folks that I've talked to that they just have Tums around that, oh, I need to take a Tums. Oh, I need to take Tums, which isn't bad because that's calcium. Our body needs it anyway.
Hmm.
So it's very light. I've had one patient who had an allergic reaction to the medication. Um, and she knew that within a couple of hours. So hers was very rare, but it does happen. So if that does happen, then we would work with you to talk to your providers if that happens.
Is it ongoing that excess acid, or does it
Oh,
mitigate after a while?
it's a great question. It's not ongoing. Your
Hmm.
body has to get used to it. The body
Sure.
has to adjust to these new peptides. And within I adjusted within 3 weeks when I did it the first time. Other people have taken like between 4 and 6 weeks to adjust. But after that, they have no problems. And I think some of that has to do with age, or activity level. There's not really a way I can tell if it's going to be quicker or slower. But your body does adjust to the peptides because they're natural peptides. They're things that we create anyway. So your body does have a way to compensate and to handle the nausea and adjust as needed.
Is there anything even close to this medication to help curb your appetite and the things that it does to help with weight loss?
Is there anything comparable?
Yeah,
No, yeah,
no.
not really. My experience has been I've been heavy my whole life. I've tried so many diets. I paid for the meals, I've tried the pills, I've tried so much. And this was the one thing that worked for me, which is why I got into this business, is at the time everything was like $1,200 and I was not going to charge that much. I wanted to try to get this out to people like me, normal people. And so that's really still my goal. I want to see changes in people's lives, especially people who had their weight hold them back from experiencing life. And so that's kind of what my goal is, or my hope is.
Hmm. Um, I can eat well.
Yeah.
I can exercise. I don't lose weight.
Oh, yeah.
And I'm sure I'm speaking for many others. Am I the best eater? No, but it doesn't make sense. I should be, yeah, if I cut back a little bit, eating a salad with some chicken in it, like
Mhm.
like almost no calories. I mean, it's
Yeah.
but the weight and exercising, decent, not going crazy. It just I'm maintaining, not and that's where it's at. Why do people report that? What's going on there? Why don't we lose weight if we do what we think is reasonable to support it?
Well, I'm not a specialist I'm not a clinician. But we know that with age, we change. When we're younger, we have a
I knew
higher
that I
metabolism.
knew that was coming. And it's
Yep.
true because I think
Yeah.
back this time of the year in my 20s and
Yeah.
30s, even low
Yeah.
30s, I would just eat a bowl of cereal, not anything else for the day because I didn't really need to. And I just hit the road. I jog and bam, it
Yeah.
just melts off. And I'm ready for the bathing suit, ready for the beach.
Yeah.
Yeah, it was.
Yeah.
I took that for granted back then.
Yeah, I tell you, I think a lot of people did.
Mm.
For me, I had so this is a little bit more information you care to know, but I had a hysterectomy in 2018, which threw me into menopause, which is partly why I gained so much weight back. I started this medication after that, and it worked on a post-menopausal woman, which is where the female people struggle with. It's like, how do we get this off? How do we, there's not a lot we can do. I get a lot of it is just age and adjusting. And so this is supposed to help kickstart your weight loss. And so it's good for anybody that wants to lose 25, 30 pounds to be on it short term. That kickstarts it. And then you're able to maintain that through your activities that you do.
Tell me about some of the new things that are happening with Go Figure Health. What's the Expo Pod?
The Expo Pod is it's a think Mork and Mindy and the egg. It's kind of the egg, but it's a multifaceted device that delivers things that help with weight management, helps with muscle recovery. So if you're working out a lot, what in pain relief, and I, wrenched my back or whatever, it helps with that. It does relaxation and wellness. The pictures, I just bought it, so I'll get it within about 5 weeks. The before and after pictures are amazing from what they show you. You're able to, it targets your weight loss, it targets healing, it does some aromatherapy. And so we're excited to bring that in. Hopefully that will be there within the 5 weeks. I just ordered it, last week. And it's supposed to be this wondrous thing. And I've heard a lot of great things about it. The other thing I want to bring in is red light therapy
Mm.
bands that you can wrap around your body, and they need to touch your physical body. So there's not like pants or anything on. With red light therapy, the bulbs themselves are energizing your cells so that they're moving around, fat cells. And those fat cells have 4 minutes of stored energy. Anything beyond that, it's expending energy they don't have, which is really what we want it to do. And so you're in a 20-minute session and you're able to expend all of this energy into the cells that essentially liquefies the fat that you're able to process out of your system. Don't go out and eat a hamburger afterwards. Eat what you're eating, the salad and the chicken. Be healthy, be mindful. Those two things are additional offerings that we're going to be bringing into the practice. And we will have pictures, before and after pictures of myself, some other people, so that you guys can see truly what it does, rather than the before and after pictures of the company selling it. So I'm really excited about that exopod. It's one you lay down in, and it's relaxing. So I'm really excited about that.
It almost sounds like the Jetsons, where you go in
I know.
and you come out a different
It
person.
does.
Um, what's actually going on when you go in the pod?
So in the pod, they've discovered the different light therapies that give us benefit. We see the colors, we see all that stuff, but the different light therapies, and it's a dry sauna, and so it's warming your body up, and there's a vibration plate that will I don't want to say this, but will jiggle you and allow you to kind of allow your cells to move around. And it's an all-in-one device, which I think is fantastic, because you don't have to go to a massage therapist necessarily for your muscle pain. You don't have to go to plastic surgeon for the tummy tuck. You don't have to go somewhere else for this. It's an all-in-one tool that helps you out with the different areas that you're looking for. And particularly for us, it's the weight management.
Do you have a body scan? Do you do
I
those?
do. Yeah, I do. I have a 3D body scan. And what I'd like to do with this exopod, is they say that based on what you're asking for, 3 sessions, 4 sessions, you should be able to see a difference. What I want to do for my customers or my clients is do the 3D body scan that you can also use to identify your risk of health issues, and identify where you need to target. And it's not weight based, it's size based. So it's not, you have to lose 30 pounds. Let's work on getting you to lose an inch or 2 inches. But with this exopod, after the 4th visit or the 3rd visit, we'll run it again, and you should immediately be able to see the changes where your body is. And the 3D body scan, I think, is extremely helpful, because you're able to see, for people like me, I lost 50 pounds. I still have a hard time seeing that I lost 50 pounds. But had I had the 3D body scan before and the 3D body scan after, I would have had a truth picture of what it looked like, and it would have been able to see that. So we want to incorporate the 3D body scan into the care of all of our patients, so that they know what they started off with and then what they're ending with.
Well, it seems like that would help somebody focus on the progress
I think so.
instead of, the end game,
Yeah.
which is the numbers game, stepping on a scale, and that not doesn't necessarily represent your progress. We get
Right.
fixated on that, on a number, but you could be losing, fat, but still gain muscle, and maybe you dropped a few pounds, but you could see a difference when you have something to compare to.
Yeah.
You
Yeah.
mentioned prepared meals. I actually have those. I go to a place. I don't cook.
Okay. Neither
Um,
do I.
just it's convenient. Is it the best? No. Is it pricey? Yes. Is it better than some of the other things I could be eating? Yes. Now they say right on the window of the place that it's 80% diet and 20% exercise. Now, of course, they're selling meals,
Yeah.
but
Yeah.
that in itself, based on your journey, your experience, people you've connected with, clients you've talked to, what do you think that number is? Or is it even possible to give a number in terms of, weight loss, optimal health, diet versus, I hate the word diet, by the way,
Yeah.
um,
Yeah. Yeah. Yeah.
that versus exercise. What do you think?
So from my experience, I've done the whole exercise thing. I've done all that. With this shot, it was what I ate. I wasn't doing anything extra movement wise, exercise or even movement wise. I sit at a desk all day and work. So I think that it's a lot of diet. I think that we're ingesting a lot of sugar, a lot of things that starches that we shouldn't be eating as consistently. And the fact that so much sugar is in American food is bizarre to me. I went to Greece one year,
Mhm.
had a week or 2 weeks away from American bread, came back, tried American bread, and it was so sweet. It was surreal. And so I think
Yeah.
that we're eating a lot of things that we don't know we're eating.
I billion% agree with you, and
Yeah.
it's all habitual. I have not touched a salt shaker since I was a kid. I'm not even, I really mean that. I have not put my hand on a salt shaker. I don't put salt in anything. And my dad, beat on me verbally
Yeah.
in a nice way once or twice, saying, well, don't put salt on that. There's plenty of salt. And from that day, I never touched it.
Mhm.
And now I find myself when something's salty, like, it's overkill. And it probably
Yeah.
is loaded with salt. I'm just more sensitive to it. Same
Yeah.
thing with sugar. Like, doesn't excite me anymore. I'll have, my go-to comfort food is a chocolate shake. Maybe every 3 months or whatever, I'll get one, put some chocolate sprinkles in. This is going to be great. I'm going to have it.
Yeah.
And after
Yeah.
a couple of sips, I'm like, oh, that's all it is. It wasn't that more than,
It's not worth it,
it's
right?
not worth it. It's not worth it. Yeah.
Yeah.
Mm.
Yeah. So I'm
And
with
and
you.
I take my daughter to Starbucks and she gets, a chai latte with brown sugar, blah, blah, blah. I get and here it is, a decaf coffee with sugar-free flavoring, and that's it. And I
Yeah.
will sip hers. It's like the daddy thing.
Yeah.
When we get it, I'm like, got to test it, make sure it's safe for you. And I'll
Yeah.
have a sip or two. That I'm good. That's
And then
it.
you're done.
I feel like I got my fix as opposed
Yeah.
to drinking the entire cup. So I think
Yeah.
we train our brain for good and bad.
Yeah.
But
Yeah.
when you're down that road or you're not losing weight, even though you're doing what you think you should be
You
doing,
get
uh,
discouraged. Yeah.
then there's medication for that.
Yeah. Yeah.
What's the best way, Misty, for people to connect with you?
So if they go to go-figure-health.com, no, go-figure-health.com, and they do a contact us, we will respond to them. Or if they want to call us at the office at 720-513-0001, and we'd be happy to talk to them, whether they are in Colorado or not. I would love to talk to people.
Yeah, and this needs to be done in office. That's where you administer the medication.
Mhm.
Can somebody go there? Let's say they have a version of needles. Can they say, you know what? Give me the lozenges.
Yeah, yep,
Because-
they can absolutely do that. We will talk to them and figure out what they want to do. Everything is prescribed by a provider and we order it specific to the patient. So whatever the patient needs to get, whether that's a lozenge with B12 or something else, we do that. And if they live in Grand Junction or they live in Colorado Springs and they don't want to come to the office, we have a pharmacy that will ship direct to them with the needles, with the alcohol swabs, so they can do that themselves if they want to.
Can that be done outside of Colorado?
My license is only in Colorado, but
Gotcha.
I would be happy to put them in touch with somebody that I work with if they call from somewhere I know somebody.
Gotcha. All right. Yeah. Thank you so much for the insight, Misty.
Thank you.
This is what people have been talking about for a long time. And
Yeah, yeah.
side note, just want to share your website's fantastic. There's
Oh,
so much information, it's got a good vibe to it. And it's credible as you are. So it reflects you
okay.
well. And
Well, thank you very much.
I appreciate you being here. Thank you.
Thank you. Have a great day.
You too. We'll be right back.
This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.